Well, the federal government is buying more than 20 million COVID-19 antigen rapid tests, which can produce results in just 20 minutes. These types of nasal swab tests were approved in the U.S. months ago, but this is the first one approved by Health Canada, and it's not clear when these new test kits will actually be rolled out in Canada and who will get to use them. So let's get some answers. Anita Anand is Canada's Minister of Public Services and Procurement. She has been leading the federal government's efforts to speed up testing and procure supplies of vaccine for Canadians, and she is with me now. Good to see you, Minister.
Great to be here.
These 20.5 million new antigen testing devices are being purchased, along with the 8 million rapid ID now tests also being purchased from Abbott. We learned about that last week. When will any of these rapid tests be available for use in Canada?
Well, I just want to be clear, Peter, right off the bat, that we have been procuring rapid tests throughout the year. The Gen Expert test, for example, is in use in vulnerable communities here in Canada. The ID test that you referenced that we procured last week and the antigen test that we announced yesterday are now in our stockpile also, and the ID Now test will begin to be delivered next week. 2.5 million will be in Canada before the new year, and the antigen test has a delivery schedule that we are currently negotiating, given that it was just approved on Monday.
Okay, so to be clear, some of the rapid ID tests arriving next week, the antigen test before the end of the year, right?
Yes.
Okay. There's an urgent need for these tests now, and we listen to what Canadians are saying about it. The provinces are facing serious spikes in numbers. And these tests are already in use in other countries, including the United States, and have been for months in some cases. So a lot of people want to know why it's taking so long to get them for use in Canada.
So I really appreciate the question, and I just want to put the federal role in procurement of tests and PPE and all other procurements for COVID into context, that the federal government is here to support the provinces and the territories, and we're doing just that. And so that was the purpose of, for example, the $19 billion Safe Restart program, which had money allocated for the provinces to do their procurements if they chose to do so. So we are playing a supplementary role here, Peter.
But aren't you playing the leading role in procuring testing?
There is no question we are leading in both PPE, vaccines, and testing. So PPE, we've secured over 2 billion pieces of PPE. In terms of rapid tests, we have very many contracts in place and being negotiated for additional rapid tests so that we can support the provinces and territories in what is a need for testing. But these rapid tests are supplemental to the existing testing regime. We have the supplies to execute over 200,000 tests per week in terms of what we've procured federally. So I want to stress that this is a very diversified portfolio of testing supplies and strategies.
But so we'll take another 3 months to get the antigen test before the end of the year. So that's roughly 3 months before we get those into Canada. And as I said, they've been in use in other jurisdictions for months now. And I guess you could only start ordering, I guess, trying to figure out how the process works. Did you only start ordering them when Health Canada gave the approval? And if that's the case, are you frustrated that it took so long for Health Canada to give the approval?
It's a great question, and it does touch on what is the process and what is our approach. So certainly all of our contracts are conditional on the receipt of Health Canada approval, and we are making sure that we have those contracts in place so that we can execute very quickly once Health Canada approval is forthcoming.
Okay, but in terms of the process, because you're seeing more questions today in Parliament, the questions are all about why is it taken so long, and I guess I'm wondering whether you're absolutely okay with the Health Canada approval system, or whether you wish it had moved more quickly, given the same tests we're using have been approved in other countries.
Well, I do appreciate the question, and I understand where it's coming from, but I will say that from a regulatory process, it's important for us to recognize that that Health Canada regulator is independent and its decisions are based on its own scientific analyses. And I, as the Minister of Public Services and Procurement, don't have any impact on that process. So there's a need for us to understand that the decisions Health Canada is making are based on science, and also a need to understand that innovation in technology relating to testing is also important. And so on that latter point, we are in touch with suppliers. We are seeking to put in place contracts that are conditional on Health Canada approval so that, as I said, we can execute as soon as that approval is forthcoming. But ultimately, we need to respect the science on this.
Sure. Okay. There are when you say you've been in contact with other companies, that there seems to be a little bit of frustration, if I can put it that way, with some Canadian companies. Some 10 of those companies, they've developed rapid tests as well. They're waiting for Health Canada approval. Are those Canadian companies getting serious consideration for their tests as well, or are we only looking at companies from outside Canada?
So it's a great question. Of course, we saw this same question arise with regards to PPE, and we built up a made in Canada or domestic capacity in PPE. And so in the same vein, we at Procurement are taking the advice of the Public Health Agency of Canada in terms of what tests we should be looking at and which suppliers we should be pursuing.
Are any of those Canadian companies?
Without doubt, we are looking at a range of domestic and international companies.
Okay, there's another problem we're hearing in the province of Ontario, and I'm not sure how directly it connects to you, but let me put it to you that problems with the numbers of lab technicians to process the test. There's a big backlog. Some of those tests are now being sent to California for processing. What can the federal government do about helping with that?
Well, again, I think it's a good question. In procurement, it's not quite a question that's in my portfolio, but I would say that the most important thing for us to remember is that from a constitutional standpoint, the issues relating to health and the distribution of health services rest within the provinces. And so at the federal government level, what we have really tried to do every step of the way is to support the provinces in these issues, from PPE to testing, and we'll continue to do that, whether it's Ontario, BC, Alberta, what have you.
All right, Minister Anand, thanks for your time tonight. Appreciate it.
Thank you so much, Peter. Take care.